Yeah, hi. Today we thought we'd discuss about how ChatGPT has helped us in our practice. Has it helped us? Definitely yes. How did I got exposed to the ChatGPT? See, I always had a problem of documentation of a rationale of a patient. That means why I have taken that decision. So I used to have this problem, and I used to write it and all those things. But every time it used to be difficult depending upon the busy practice you have. If I'm free, I should document. I say if I'm busy, something. So if I have started a drug, say denosumab in giant cell tumor. So why have I extracted that drug? I used to think. So, and if the patient comes for follow-up after 6 months, you would not remember why did you start that drug, unless you have a real rationale of documentation. That problem I used to have, and I told my engineers to develop a mic-based, voice-based to text, so that we can record the rationale, complete consultation. But in this time, this we started about 1 year back. But during this time, this ChatGPT happened, and it's now rightly. I immediately after the consultation, I immediately give a dictation. It gives a text, and text it gets to organize text. Organized text, we print it out. Simple, but it gives you a nicely organized path. Why it is important? As a doctor or as a practitioner, numerous studies after the invention or after the EMR has come, most of the doctors are worried of entering the document data. Not just doctors. Most healthcare professionals are busy entering the computer data, which is nothing to do with the care. So that is the worst thing, because if I want to talk to a patient, understand what is the problem, I would rather talk to the patient eye to eye and understand what is the problem. Instead, most of the time, what's happening is you're talking parallelly. Oh yes, okay. Oh yes. There is no emotions. There is no listening. It's only we're documenting. We're clerks of the computer. So, but now, I think with this, we listen to the patient. We particular lab. Then at the end of the consultation, I translate the whole thing, dictate to the phone, ChatGPT, and that will convert it into a format. And also I can tell the why I've taken the decisions, when to come back, what are the exact steps. Even if I'm ordering the imaging, say I'm ordering an MRI. In MRI, what exactly I'm looking at is very important for the radiologist. Otherwise, most of the times you write an MRI or the tumor and send it. But the radiologist would, in oncology particularly, would really want what is that I'm looking at that MRI. If you give a right way for the MRI, he will look at it. The radiologist will look at that exact point what you're looking at, and he'll give us a decision. That notes will be given. So that is another big point. And pathologists. Again, pathologists usually are kept in dark most of the time. That means you just went for histopathology, IHC, and without the clinical input, without the radiological input in oncology, pathologists, I don't know, it's very difficult for them to give a diagnosis for sure. But I think with these things, for sure it has helped them, and me also, is to. And what are the negatives of ChatGPT? Yes, learning curve, but short learning curve. That's important. And you want to buy a premium version, you can buy. It's something over 2,000 rupees per month. But before buying that, you experiment the free one. That's my thought. And hallucinations of AI tool, and wrong spellings, mathematical mistakes. These are all some of the things which you should be worried. Spelling mistakes. But it is much, much better than what I would write or anybody would write it as a document. So what we do, we take these notes, send it for printer, print it on a lettered queue to the patient, and save the notes in the EMR. This is how we do that. An example, I'll show it. Okay, this is the mic button. So here I will start explaining about the patient. For example, this is a patient Chanapa. So patient Chanapa has been diagnosed with osteosarcoma of the left femur. He's finished chemotherapy of 2 cycles of methotrexate based protocol MAP regimen. He's doing well. But right now we have to see for the possible limb salvage surgery For that, I want to understand how the disease has responded with MRI with contrast. I want an MRI with contrast to assess how the chemotherapy has worked. So with these things, I would need an MRI with contrast. Particularly, also I want to know the size of the tumor from the knee joint and how much is it extending for the radiologist note, and how much is the resection needed we have to plan. And otherwise the patient is doing well. Also planned to meet the anesthesia to have a checkup of pre-anesthesia checkup for about 6 hours of surgery and about 500 ml of blood loss. So considering all these things, please with all these reports, I shall see this patient again on the 8th of July with all the reports. Till then, patient has to be continuing with the elbow crutch, immobilization, and tablet Ultraset SOS if there is any pain. Apart from that, with the blood counts being cleared by the chemotherapy team, pediatric oncology team, I shall see him on the next follow-up date with the above reports. Please, can you please generate the complete OPD notes regarding this? Thank you. So if we click this, it will now transcribe. So it's transcribing. Yeah. So this is the text it popped up. Now I send it to go. So it will go. So now if you see, so this is the whole notes. It came in an organized note, everything. See, if you see plan ahead, imaging, purpose, surgical planning, pre-anesthesia evaluation, supportive instructions, follow-up. So must bring. What are the things must bring? PSC clearance updated, any pending, remarks. Patient is currently doing well. So this is how. So it will also ask you, do you want to have a PDF? Yes, but depends on that. I would rather copy this and send it to my patients in the WhatsApp to my team so that they'll copy it to the EMR and print out the notes. So that's about it, and I think that's the way. And the next question, what generally is the ethical issues, right? Does the ethical standards being and the patient confidentiality in the clinical setting, is it okay with the ChatGPT use? I think with the present user agreement, I think it is quite safe, but we don't know on the longer run. But as they're using it inside the premises and inside the our documentation chambers, I think it's good to experiment and learn about how do we use it for the future to make it even more legal, get a framework of the legalities and the patient confidentiality. Yeah, this is one thing. Now, but the last one, where can we use these things? Number one, outpatient. Very clearly, it gives you very free time to think and act. 2, operation theatre notes. So in the operation theatre notes, by the end of 6 hour or 8 hour surgery, you're very tired. You would not really want to write all the steps what you did it in 8 hours in the matter of 5 minutes. No way. Here, but you go on telling whatever you thought, whatever the process steps you went, whatever the reconstructions you have done, where the tumor you felt, what is it, where was it close to the margins, how big was it. A lot of things happen during the surgery. We can give these inputs and it will give you a nice format. Operation theatre notes, no doubt. Incorporating into photographs is the next step. I'm experimenting on the Ray-Ban Meta in the future for sure. I think it will be the best for the intraoperative picture. Key pictures can be taken and incorporated into the notes. Otherwise also you can upload your picture to ChatGPT and give it notes, it will keep. There's no doubt about it. This is another thing. I think if you ask me a question whether should I use it, experiment it, you can't escape it. You should start experimenting. Any clinician. Am I tech savvy? You don't have to be tech savvy. You know how to use WhatsApp. For sure, ChatGPT is more easier than WhatsApp, I think. Should I have a learning course? Nothing like that. I think it's the most easiest I've seen in any apps in the recent future, in the recent past. Yeah, I think with these sticks, the AI is here to stay. I could say that. I think where we have to use it, I don't know. Like Apple recently came out with a paper that AI is completely relying on memorizing rather than thinking. we can defer that paper also. As scientific persons, we should know that. Yeah, we should not allow it to think right now, for sure, but we should use it as another improvised Google so far. And it's very easy for us to add a rationale into the notes. And also, it's very important in the future that we have to have these tools and build an agent, AI agent, so that it will act like almost a secretary, maybe a clinical practice. It's a small tool. With one secretary, you can run a clinic, incorporating a Paytm for the billing methods or Razorpay. I think with these multiple incorporations, I think it will become very organized clinical settings, and also the data can be very well. And we do for surgery, if you want to take a picture of an important step because you're seeing directly, I think that's one cool thing what we can incorporate the AI tool. I think these are the tools which we are using it right now. I think everybody should put their hands onto any AI tool so that you should start using it and understanding, and you are saving your time and also making your practice very organized, streamlined. So I think that's about it. And if you have any questions on this line, you can put a comment down, or I can try to answer because I think I have generated more than 1,000 reports so far using AI tool with almost all the patients. Every patients we generate the case report using AI with the help of AI. So that's about it with ChatGPT. I think any questions, as I said, they can put it down and I'll try to answer it. Thank you.